given the context of the events happening last week around the police violence against Black people and the resulting protests, we would expect to see in the near future a rise in number of infections in some areas. Some of us working in the health field are contending that the use of tear gas, which makes people cough and have teary eyes, will likely increase the risk of COVID-19 transmission. And if we are having a concern about the spreading of the pandemic due to the protests, we would recommend that the police do not use tear gas. On the prevention front, there is a survey that found that men were less likely than women to wear masks, which is not that surprising because in general, men don't do as well as women with healthy behaviors. If you look at the association of genes with COVID-19 disease severity, they found 2 genetic loci, including the one that actually determines a very common thing that we know, which is blood type. Blood type A were, for some reason, more likely to have more severe COVID outcomes. On the testing front, Dr. Redfield, the director of the CDC, admitted in Congress this week that data collection has been insufficient to address disparities. And the Department of Health and Human Services has stated that testing data submitted to the CDC will have to have race, ethnicity, age, and zip code information. Those of us working in health disparities have known for several decades that the main underlying causes of health disparities are the social determinants of health, and they include poverty, education, the environment, and healthcare access. Racism is often thought to be one of these determinants as well, because we know that chronic exposure to racism causes the body to change adversely through the release of stress hormones and neurotransmitters. We also know that acute exposure to racism can lead to death, as in the case of the recent killings of George Floyd, Breonna Taylor, Ahmaud Arbery, and others. From a health disparities perspective, the George Floyd shooting was an acute exposure to racism, with 4 police officers serving as the vectors that delivered the disease of racism and its ultimate health outcome, death. But racism also underlies the other social determinants of health, because racial ethnic minorities, particularly Black Americans, also suffer more from income inequalities, educational disparities, and environmental degradation. So from the point of view of the health disparities researcher, there is not much new about COVID-19 pandemic other than the novel coronavirus. The pandemic has had 2 major effects though, besides the obvious health and economic ones. In my view, it's severely stressed all of our dysfunctional systems, the health, economic, legal, and political, to their limits and broke them. We can no longer pretend that they are good enough. They were never good enough except for those of us who enjoy privilege. That is the second major effect. It ripped down the so-called color blinds from our eyes so we can no longer pretend that we all benefit or suffer the same. It has been distressing for us to find out that 1 out of 2,000 Black Americans have died in the COVID pandemic, and that their mortality rate is 2 to 3 times more than white people. But again, this is not surprising to disparities researchers. Before all of this, there has been data that show that even Black people in high socioeconomic level have much shorter life expectancy than middle-class whites. The fact is that most of us who are not directly affected hear these reports and then move on. Nonetheless, the data from the pandemic has been revealing and important. And this is one reason why I am constantly putting out the need for more and accurate data. And as has been for decades, the data in this pandemic has been insufficient and often inaccurate. One thing I've learned from 20 years of health disparities research is that whenever the data is not there, it's because somebody powerful doesn't care. And when it is not accurate, it is because somebody powerful wants it that way. One very important example, Congress has for decades prevented federal funding of gun violence and gun control research. So it's no accident that we are always saying we need more and better data for racial and ethnic minorities because there are not enough minorities in powerful places. And in the absence of data, America can pretend that there are not so many health disparities. Just as in the absence of cameras, policemen and law and order people can claim that crimes had been committed and murders were justified. But I'm not a typical academic researcher who only asks for more data. I view those who ask for data on disparities who do not intervene as being complicit in the racist system. We know that even before a single data point was collected, there would be significant health disparities in the pandemic. And we must assume that in the absence of additional data, that there are disparities, not that we have to prove they exist. The people who insist on seeing data showing disparities before acting are likely to be the same people who, when such data are collected, will deny their existence or not take them into account in their policies. And so it goes with the economic downturn. We knew before any data came that the small business stimulation package would not go equally to our communities. We know that low-wage workers will be the first to lose their jobs. At my university, it seems like every single Black man, from the janitor to the tenured professor, has a police encounter story. To me, that's data. There have been enough police shootings of Black men in our time to have the statistic that 1 out of 1,000 Black men can be expected to be shot by the police in their lifetime. We don't need more data. I'll finish by saying, why would a physician and public health researcher concern himself with unemployment and police violence? It is for the same reason that we concern ourselves with climate change, homelessness, food insecurity, educational disparities, income inequalities, and racism. Because the final outcome is a sick or dead person and sick and dying communities. Because racism is a disease and police brutality is a disease vector. And the job of a physician and a public health interventionist are the same. Control the vectors and eradicate the